According to the American Academy of Allergy, Asthma, and Immunology, here are the recommendations to lessen the effects of seasonal pollen allergies. Keep your windows closed at night and use air conditioning, which cleans, cools, and dries the air. Minimize outdoor activities early in the morning between 5 and 10 a.m. when pollen is most prevalent. Keep your car windows closed while traveling. Take a vacation to an area where pollen is not prevalent, such as the ocean. Take the medicines prescribed by your healthcare provider. Don't spend much time outdoors when the pollen count is high. Don't rake leaves during pollen season. If you are allergic to grass, wear a mask or have someone else mow the lawn. Don't hang bedding or clothing outside to dry. So those are the recommendations from the American Academy. Dad, Dr. Z, perennial top doc for allergy and immunology in Rhode Island. Do you agree?
Not quite.
Throat tickle or itchy eye, skin rash or a patch of hives. If allergies got you down bad, then just ask my allergist, my allergist dad.
Welcome to My Allergist Dad. I'm Drew, and as always, I'm here with my dad, top doc for allergy and immunology in Rhode Island, as recent as the 2026 edition of Rhode Island Monthly, Dr. Z. How you doing, Dad?
Great.
Good. Well, let's pick up where we left off. I was listing the recommendations to prevent pollen allergy and pollen allergy symptoms that were given by the American Academy of Allergy, Asthma, and Immunology, and you didn't quite agree with them. Why is that?
Let me clarify. Of course, they all are good recommendations, but it's not how I like to recommend them to my patients.
What do you mean by that? As in, you agree that they can help with symptoms. Those are ways to maybe help prevent symptoms, but that's not your...
It's not my preference.
In what sense?
Sounds like a great way to enjoy spring. We've had a really bad winter. It's been long. It's been a lot of snow. It's been cold. Everybody's dying to get outdoors and enjoy the weather. Nature's great for you. And what are they saying? Stay indoors, move away, vacation away, close up this, wear a mask. I mean, the mask idea I have felt for my grass allergic patients is a good idea for such a high load of grass pollen
When you're mowing the lawn.
or grass allergen. Recommendations make sense, but my intent, what I tell patients all the time, treat the cause, defeat the symptom, is to work on the problem itself, which is lack of tolerance to your environment, and to improve the tolerance. And even if you're going straight to medications, my goal is to go after what's driving the worsening allergy as the season goes.
You always talk about defeat the cause, treat the symptom. These are just reacting to
Treat the
causes.
cause, defeat the...
What did I
Yeah.
say?
Defeat the cause, treat the symptom. But it's treat the cause,
Treat
defeat the symptom.
treat the cause, defeat the symptom. These seem to be avoid the cause, prevent the
And
symptom.
and treat the symptoms. It's avoid the cause and treat the symptoms. I mean, I always joke and say that once I moved back, when I identified that dust mites triggered my asthma, and I moved back to a dust mite area and went on the immunotherapy, initially, I knew when patients would be calling because my allergies were really bad and I was allergic to pets. And now I like to say I have a convertible and a dog.
Double flex.
On those warm, high pollen days, I have the top down.
And you have the dog in the front seat.
Back seat, it's safer. But,
Yeah.
well, in the front seat of the convertible. But exactly, the two of us are enjoying the outdoors. And that's my ultimate goal for my patients. And that's where I defer. I meet patients, I'm doing a research trial for pollen allergies, which will allow the patients to enjoy the outdoors and not restrict themselves. And they all say to me, I hate the spring. I lock myself indoors. I'm like, that's not the life you want for your patients. You want your patients to enjoy the outdoors. And it's interesting, even if they don't have the time or they didn't have the chance to prevent the symptoms with the immunotherapy this season, the first thing I say to patients is to do the opposite of what they're all doing. They all start antihistamines 2 or 3 weeks in advance. And I'm like, that's not going to fully help you.
Well, it's funny you say that because we've talked about in certain instances, like when you're going to your in-laws or a family member's house that has dogs in it, you pregame and you take antihistamines a few days in advance. But for pollen season, you don't want to start pre-gaming, so to speak, with antihistamines.
No, we discussed it pre-gaming, as you like to say, but I emphasized the anti-inflammatory pre-gaming. Antihistamines are secondary. So studies have shown for a long time, and is that if you start your nasal steroids, because most of my patients, their biggest symptom is through their nose.
And nasal steroids, those are the anti-inflammatory that you just mentioned.
Right. And the brand names people think about are Flonase, Nasacort, Nasonex, Rhinocort.
Not to be confused with the nasal EpiPens that you can get.
Yes, the Neffy.
Keep those separate.
Yeah, don't keep Neffying yourself every day. That's not a good idea.
Yeah.
The studies have shown if you start them regularly, a minimum of 2 weeks before your season, it blunts the seasonal worsening. And I remember reading about a trial, it was like probably 15, 20 years ago, where in some of the research trials for allergies, they have these allergy exposure units. In fact, where I'm doing the research in Andover, he has a outdoor trailer where patients will sit there and they blow pollen in. So think of that. They had discussed where they were doing a controlled trial and they had advertised for patients who were allergic to ragweed. And when they got the patients, they had to have a certain symptom score, demonstrate skin test reactivity at the time, and by history say, have X amount of symptoms repeatedly each fall season for the ragweed. And when they took the patients and put them in the exposure unit, a large percentage of them didn't have symptoms when they blew out the pollen at much higher levels than they were typically exposed to at the height of the season. So they went back and scratched their head and said, well, are these patients lying? What's going on, et cetera? And I don't have the name of the trial, but I distinctly remember this. But what was interesting, the word we use all the time, about the trial was that a week or so later, 1 or 2 weeks later, they said, okay, we're going to bring the patients back and reassess this. And when they did, many of them became symptomatic who weren't before. And what they showed was it's called a priming effect. And if you look at studies on the pollen, they show that often as the season progresses, symptom scores go up. And at one point, even when the pollen counts, the daily pollen counts correlating with the symptom score drop, the symptom scores continue up for an extended period, even with the pollen counts down.
That sounds a lot like how, an allergy reaction usually doesn't happen until the second exposure, and that later exposures can have even more severe reactions than previous reactions.
That is a risk people speak about, but that's not what's going on here. Mm-hmm. So when you're exposed, especially people who are allergic to an allergen, you have what's called an early and late phase response to the allergen. And so your immediate response is the one that has the histamine effect, is the one most people experience. So something simpler to understand is, let's say you're allergic to a cat. You pick up the cat and right away you'll be sniffling and sneezing and itchy all over. And that's where taking an antihistamine, especially something like a Benadryl, would work well. But even though you took the antihistamine and the Benadryl, several hours later, 4 to 8 hours later, you become symptomatic again. You're congested. You might even find you wheezing. And all of that is called the late phase response. And if you look at nasal...
And that's all related to that initial exposure.
Exactly.
So it's like I could have showered, put in the laundry, all my dog hair covered clothes, and I could still be in bed wheezing from that first exposure.
And the same thing's going on with the pollen. And so what happens with patients is they start taking the Claritin, the Zyrtec, the Allegra, and they're doing
all of
well.
whom, if you're listening, if you want to sponsor the show, Claritin, Allegra, Zyrtec, we would gladly take your money.
Exactly. And anyway, so patients start taking that, and initially it's working, but as the season goes, they're having breakthrough symptoms. And the thing that starts bothering, in addition to their itchy eyes, is the nasal congestion, the mucus, etc. That's the late phase inflammatory response. And the antihistamines aren't working, especially the second generation ones that don't have drying effects. And that's why they end up starting to take Claritin D, Allegra D, the decongestant, to dry them up.
Oh, that's what the D stands for. I didn't realize that.
Yes, the decongestant. And
so
that's
is
the
Sunny
ones where
D, is Sunny D, that orange juice, a decongestant?
No, it's Sunny D.
Okay.
It's a good idea.
Okay. Yeah.
Here, take your orange juice. And wow, I really feel open today.
I can breathe again.
I can
and
breathe.
I'm getting
That's great
vitamin
orange
C.
juice.
And sugar.
Yeah, here, and I have energy, and I can breathe. Getting back to it, that's why, but if you start the nasal steroids earlier, it blunts that seasonal worsening, that priming effect. So patients stay more open. But because they're so sensitive.
Sorry. What blunts it?
Starting the nasal steroid, the Flonase, the Nasacort, the Rhinocort, all those. So when you start the sprays earlier,
before the pollen count even goes up?
Let's say that by the middle to late April, you are miserable. Early in April, you're really not symptomatic. You should start it then. So try to start it 2 weeks before your season.
And how do you know that?
Because your season is almost repetitive every year.
Even if the winter is different each year?
It starts a little later, but by Mother's Day, most of the people in our part of the country who have bad tree pollen seasons to birch and oak, they're already miserable.
So look at your calendar. When are you taking your mom out to brunch? Go 2 weeks earlier and start nasal spray.
Well, probably 4 weeks earlier.
Go 4 weeks earlier and start nasal spray.
Right. And then if you start feeling itching and stuff, you start the meds in. Asthma is, people always talk about as one airway. It's like what's going on in the nose goes all the way down to the lungs. And a lot of people, as things get worse, they start having asthma symptoms. And they even did allergen challenges on people who don't have a history of asthma. Maybe their sibling has asthma, but they're very allergic to the pollen. And when they get enough of a load, they start wheezing or have reactivity. But I always remember a story that I probably shared with you. And again, it's a cat allergy and it's asthma, but it's easier to understand because the pollen season and it's specific for a cat. So I had this patient probably 30 years ago. Time keeps flying. And at the time, he was a professor at Bryant. So this is before online dating, so long ago. And he was this nice guy, early 30s, newly divorced, no kids. And everybody was trying to fix him up. He was a nice guy. And he agreed to any blind date as long as they didn't have a cat. He was severely allergic to cats. And he had just started seeing me as a patient. And at that time, we weren't doing the sublingual, we were doing the allergy shots. And he had started allergy shots to cats. And so he also had asthma, was exacerbated by exercise, but he would take 2 puffs of his inhaler, albuterol, 15 minutes before running. And it would blunt asthma, prevent asthma exacerbation, and he would run 3 miles consistently 3 times a week, and it was great. So one Friday, early on, as my patient just started, he reaches out to me and said that needed help. What happened was that Sunday, it was Friday, so 5 days earlier, he had been invited to a party. Now, ended up the people who had the party, not the woman he was to meet at the party, had a cat.
The hosts of the party who were luring him because they said, we have a woman we want to introduce you to. Those hosts had a cat.
Correct. And they really didn't follow the rules of cat allergy controls. And what they had done is vacuumed right before the party.
Which we know multiplies the cat in the air by 7 times.
Well learned. Anyway.
Yeah, you had told us about that with the piano instructor who would vacuum before.
Exactly.
Your patient who was allergic to cats.
Correct. So his lung function, everything was great. So he goes to the party. He was there probably 5 minutes and had an asthma attack as soon as he got there.
Nothing more charming to a girl you're trying to impress than if upon meeting her, you're having an asthma attack.
Correct. I have to go. So he left. He was there 5 minutes. Fortunately, he had his inhaler on him, and he used his inhaler, and he broke the asthma attack, and he was much better, said, I'm going home. So he went home, took a shower, closed down the hamper or burned them out. He didn't want to have anything to do with them, and seemed to do well. But at around 11 to 1 o'clock, probably 1 o'clock in the morning, he woke up from sleep with an asthma attack.
The late phase response?
Very good, Drew.
I'm learning.
Yes. Still could get you into medicine. But anyway.
We've talked about this.
So anyway, in the middle of the night, and that's the late phase response to that 5-minute cat exposure. So he used his albuterol again. Fortunately, it worked well, and he went to sleep. So that was Sunday. Now it's 1 o'clock in the morning on Monday. Tuesday morning, he's feeling great. He gets up to do his usual run, takes 2 puffs of albuterol, but this time, after a mile, he has another asthma attack. And that's the late phase response causing inflammation of the airways, increasing his reactivity to exercise. So the point of all this, and this could easily be substituted with mowing the lawn or being out at a picnic on a high pollen day.
Out on a hayride.
Between the times that they showed us were to stay indoors. He had an asthma attack. That's a late phase response. So I ended up having to give him some prednisone, and he was back. So the point of the matter is that when we discussed our pre-gaming for in-laws, relatives, when you're going to be around it, we emphasized the inhaled steroid as a preventative for that late phase response that people will experience when they're exposed. And so my point is, start the meds early, do something like our preseasonal sublingual, all things to improve your tolerance to the allergens.
And is the preseasonal sublingual, is that a year-round thing, or is that also timed up with the season?
It's timed up for the season, but that's for patients who only have seasonal symptoms. Our year-round includes most allergens and would include the pollens. But for many of our patients, it's just the pollen season. And so we do the preseasonal treatment. And it's the one where they all say, I want what he has.
So how far out do you have to pregame sublingual immunotherapy?
Preferably 2 months.
So that one you probably
we say March. Mid to late February, but sometimes we'll go into March.
Okay.
And I've had patients further into March who've still done well.
Valentine's Day, get on your sublingual immunotherapy for pollen allergens, and then a month after that, and then mid-April.
No, early April.
Early April, so around Easter. Use your holidays. Valentine's Day, sublingual, Easter-ish, maybe Palm Sunday.
But it's really based on your season. Most of my allergy patients will tell you to the day when it's about to start. So if it really starts in late March for you, you're so sensitive, you need to start in early March.
So people also need to keep track for next year, if they aren't keeping track already, when are your allergies the worst, and kind of maybe write that down on a calendar, maybe send a secure medical email to my dad and his practice so that they can document it.
To be honest, Drew, most people who end up seeing me as a patient, they don't need a diary. They know. I have patients who can tell me almost to the day when their symptoms, seasonal symptoms, are going to start.
So I have an important follow-up question.
Sure.
Did this guy ever get to reconnect with the woman they were trying to set him up with?
No, he didn't want to have anything. That was it. He then ended up moving to North Carolina.
It'd be nicer if there were. I feel like there's a movie there where, a guy can't meet a girl because of a cat, and then a handsome, successful allergist helps him fix his sensitivity, and then he ends up with the girl.
Well, we did have a wedding. I wasn't invited, which I was a little, but so years and years ago in my Woonsocket office,
which,
there's a guy,
as everybody knows, Woonsocket is a town in Rhode Island.
Correct.
What, a historic mill town of some kind?
Yes. When we were doing allergy shots, people would come every week. You got to know the patients. And there was one guy who would come in, nice guy. The nurse and some of the staff would always talk about him being interested in meeting someone and dating, etc. And there was a very nice young teacher who was also on allergy shots. And so then after the shots, they have to sit in the waiting room for half an hour. And every week they came on the same day, or maybe they started to make sure they came on the same day, but ultimately they married each other. I think they left the area because otherwise I would be guaranteed a offspring patient, because it's like an 80% chance that kid's gonna have allergies. But
so they say if you set up 3 marriages, then you are guaranteed a spot in heaven. Would you count that as a marriage setup that you did?
Probably not me, because it's probably my staff, but I guess theoretically it would come to me because it's because of me that they both ended up there.
So maybe you get half of one?
Yes, but I think I'm only up to half.
Yeah. Well, I'm sorry you weren't invited to that wedding.
That's okay.
Well, you got one to look forward to later this year.
That's going to be more fun.
Are pollen allergies different than other environmental allergies, or is the main difference just the seasonality of it?
It's both. I find that in where we live, I don't know if they write about it all the time. It's interesting because I'm doing this trial. It's for allergic conjunctivitis, means itchy eyes, and a lot of people are miserable with allergy eyes. But again, certain things are, I think, what comes to me these days is not exactly. I used to always joke that when the pollen season is high, it's at least a 3-week delay before they come to me because they're miserable. Because first, and especially now they don't have a primary care, so it's either like the drugstore, the mini clinic, primary care, all these people, first they start with the over-the-counter, et cetera. And then when nothing works, they try to get into the allergist. But what I find is that most of my chronic allergy patients, it's all nasal. It's congestion, it's postnasal drip. We don't use a lot of allergy eye drops. The time we do is primarily cat, but it's mostly during the pollen season because this priming effect I talk about. So I truly feel like the year-round allergens, like the dust mite, it builds up and it primes you to, at one point, your exposure is leading to more symptoms. And that's my experience. It might be slightly different in the books, but I find with the pollen, it's a pulse effect. It's all at you at once. And that's why it starts affecting the eyes, the itchy ears, the nose, the throat, much more all at once. So not only is there a seasonality, but the primary symptoms often end up being more eyes than nose. Maybe because they're wearing the mask and they're not wearing like.
I mean, that's interesting. I find dogs and cats give me pretty itchy eyes as well.
Right, but that's also because you might be touching around there. But
yeah, that might be because I'm letting my dog lick my face.
she licks your nose too.
And that might be on me. But so you just, because it's like such a small particle that can get in everywhere, that's sort of the pulsing you're needing?
Yeah, and it's also blowing. It's wind blown in your face. Dust mite is heavy. It doesn't circulate.
Or if you're driving in your convertible with the top down and your dog in the front seat, you're getting a lot of allergens whipping at you.
Correct. But with the dust mite, it quickly settles. So you're not lying down every second on dust mite. So it's a different timing. But the other suggestions, when to do your main exercise, especially if you haven't pre-gamed, as you would say, and on the preseasonal, makes sense. If, the pollen counts are so high and you're miserable, it's a good idea to stay indoors. It's just not as much fun.
Mm-hmm.
It's not that I disagree with their recommendations. I disagree with
the philosophy. The
philosophy of so much of no, no, no. It's not what you want to hear. It's I want to enjoy the outdoors, and my goal is to make you tolerate. It's part of what I say all the time. Your goal is to control your allergies instead of allergies controlling you. So many people, all they do is think about their allergies and avoiding things and how it's affecting the quality of their life. My goal is that patients don't think about their allergies because they are taking control. They have control of their allergies so they can enjoy their life. So it's just a different philosophy that then has a different approach, more of the preventative, treat the cause approach. And that's why I look at it different instead of just treating the symptoms.
Look, we love the American Academy of Asthma, Allergy, and Immunology.
I'm a member.
He's a member. Maybe once they get into this episode, maybe you won't be anymore. But it's not that those recommendations are wrong. It's just that with Allergy and Asthma Physicians of Rhode Island and Dr. Z, the idea is, how do you get these allergies to not control your life?
With the immunotherapy, which is what you want to do, is modify the problem. I don't like to call it a disease. So you're back in balance, that your reg cells, your active tolerance is good. That you're just like, people will say, how do I know the desensitization is working? I'll say, because you're feeling like you have no thought about it. It's just going outside, you're enjoying the day, you're enjoying your friends, you're with the family. If there's a cat and you're allergic to, hi cat, how you doing?
Vacuum all you want, I don't care.
Around pets, you just go through what you're expected of and enjoying life and not feeling that you're just reacting all the time and then just need to grab all these meds every day of your life. The goal is enjoying it. And that's what I'm talking about.
Yeah. So, I mean, are these all strategies that you would recommend using for other allergies? I mean, if it's a year-long thing like a dust mites, would you say you would try to use anti-inflammatories and sublingual immunotherapy, just not in the same timed cycles?
Well, we have a year-round treatment. You still want to reduce dust mite levels as much as possible. And you want to get rid of mold. You want to reduce the allergens as much as possible. I mean, obviously, if someone's very allergic to pet and they have pets and they don't do anything about it, they're going to be needing meds all the time, especially. But I think I have like a 2% success of having patients say, yeah, I'm going to get rid of the pet. Not going to happen. I mean, one woman did because they had just gotten the pet and the child was sick, and it was a baby. But most of the time, people will sleep with the pet. And so the goal is to make them more tolerable.
And you can make pets or even certain environmental allergies more tolerable even if you're not changing your exposure level?
With the sublingual in time, yes.
Okay, because it's like you don't have to stay inside more. You don't have to keep the dog in the basement as long as you're doing the sublingual immunotherapy.
Well, you still want to try to reduce levels. The air purifier, be great if they're out of the bed, but it's not always going to happen.
Yeah.
But with the desensitization, you may still need some you're more likely going to need meds. The pet's on top of you every day, but you're able to function.
Does taking those meds regularly or semi-regularly, does that affect the desensitization process? Like if I'm on sublingual immunotherapy and I'm also taking Claritin for my symptoms, do those interact at all? Do those affect each other?
No, and that's the beauty of it.
And if I'm drinking Sunny D, that won't affect it?
No, the Sunny D might. No, just kidding. But no, because if you think about it, what are we doing? We're working on your immune tolerance. We're working on the part of your immune system that sets the reaction off. The medications are treating the end site. All they're doing with the antihistamines is they're blocking the receptors of the histamine being released on the end areas. Like they're blocking histamine receptors on blood vessels, on the skin, etc. Maybe there's some negative feedback benefit, but overall, it doesn't change the process. Even the nasal steroids, you're treating the end process. You're treating the reaction, the downside of the reaction. What we're working on is what starts the whole system.
So it's almost like an upstream, downstream thing. We're affecting something. We're using sublingual immunotherapy to affect the reaction upstream, but antihistamine type treatments, anti-inflammatories are the downstream reactions, which I guess is not a perfect analogy, but maybe for those geographically minded, that can help you see where we're attacking things.
Well, that's because you're a major.
I was a geography major, so I only talk about or think about the world or topics geographically. This was cool. This was enlightening. Even though you were being so rebellious at the beginning against the Academy, it turned out it's not all a no. There's nuance. It's gray. But, thank you everybody for checking out the show. Hopefully we answered that listener's question. If you're enjoying these conversations, please subscribe so you don't miss new episodes. It helps more people find the show, which we appreciate. Follow the link in our description. Send us your questions so we can answer it on the show. Email us, myallergistdad@gmail.com. Before we go, Dad, Dr. Z, any final thoughts?
I hope you guys have a great spring.
Yeah.
Enjoy it.
Get outside, touch some grass.
Not during the high pollen count if you haven't prepared.
Yeah. Prepare for the high pollen count. Make sure you're not touching grass when it's recently mowed if you have grass allergies. And if you're being set up on a date, make sure the place you're meeting, the date, does not have something you're very allergic to.
Well put.
All right. Thank you, everybody.
If allergies got you down bad, then just ask my allergist, my allergist dad.
The My Allergist Dad podcast is for general informational and entertainment purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.